Mr. Watson here, and in this video we're looking at joint type. So section 2 of the Applied Anatomy and Physiology, but I split it into two. In the previous video was on joint classification, just to emphasize that when we speak about joint classification we're referring to the fibrous, cartilaginous and synovial joints. When we speak about joint type we are referring to the types of synovial joints. Okay, and remember these videos are referring and aimed at the Cambridge syllabus. So we're going to focus on 5 types of joints, but other exam bodies, etc., may require more, just so you are aware. So let's get started. So we're going to start with our first joint type, and that is a pivot joint. Now we'll focus on 2 of these within the body, and the first one is the atlantoaxial, and you'll find this at the top of the vertebral column, and specifically the cervical section, and this is called the atlantoaxial joint, and you'll find this is where rotation of the cranium occurs. Okay, and just for a little gif here, this is what rotation looks like. You'll see a long bone there fitting inside the ring-like shape bone. Okay, so like I just mentioned, C1, C2, that refers to the cervical vertebrae 1 and 2. So right at the top of the vertebral column is where you'll find this pivot joint, with its name being the atlantoaxial. The description, so a round end of one bone fitting into a ring formed by another bone. Hopefully that's clear on the GIF. The mobility is uniaxial. Okay, so we're only getting rotation from this joint. It's around a single axis, and uniaxial is important that you know that, because in a lot of exam questions you're asked to describe joints in terms of their mobility. So if you were describing a pivot joint, it is uniaxial. And then the articulating bones are the vertebrae. Now obviously we need 2 vertebrae to make a joint, 2 or more bones as we know, but we just need to remember vertebrae, and if you specifically want to know, it's the cervical 1 and cervical 2. Now for the second pivot joint, and we're going to focus on the radio-ulnar joint. That would be the joint name, radio-ulnar, joint type pivot. So we'd quite simply find that at the proximal end of the radius, okay, the radio-ulnar joint. So here, if we look at the image, as well as the bone, we have that curved end, but the ligament is almost encircling the bone in and providing that ring-like shape. Okay, so this is how movement of the radio-ulnar would work, and we'll be talking about joint movements in a different video, but as you can see there, rotating, okay, uniaxial. So it's found at the proximal radio-ulnar joint, proximal meaning closest to the midline of the body, so the other end of the radius would be the distal end. So how do we describe the radio-ulnar joint? The radius is encircled by a ligament, as you can see in that image, as it articulates with the ulna. Okay, radio-ulnar joint. Again, we know this from the last slide. Uniaxial, we've got rotation happening, and the articulating bones are the radius and ulna. Okay, time for a second type of synovial joint, and this type is the hinge joint, a common joint in the body. And I'm just going to cover these 3 on one slide, because what we've also got coming here is another uniaxial joint. So we'll find these at the elbow, knee and ankle. And this image is showing us the elbow joint. Okay, and how this works, almost like the hinge on your door. Okay, so we've got flexion and extension. So we've got one plane of movement. So if we're describing its location, and this is a specific location of the elbow joint because it's matching the picture, we've got articulation there between the humerus and the ulna. But how would we describe a hinge joint? Well, the rounded end of one bone fits into the slightly hollow end of another bone. Okay, so as you can see there, the round end of the humerus is fitting into the slightly hollow end of the ulna. Okay, like I mentioned before, it's uniaxial. We've got movement in one plane there, and articulating bones are the humerus, ulna, and radius. It's also worth mentioning that, as we know from the previous video, synovial joints are the least stable when you're describing them between their classifications. But we also have a range of stability between the different types of synovial joints themselves. And how we know that is the more movements occurring at that joint, so joints which may be biaxial or multiaxial, you'll find they are less stable than the uniaxial joints. Okay, so moving on, we go to the condyloid joint, our third type of joint. And with Cambridge, we focus on this one at the wrist. And specifically, we look at the radiocarpal joint. So if you can see in the diagram there, right in the space of where the radius and carpals are about to meet, because as we know, synovial joints have a space in between, and then other features that provide their structure. And the condyloid joint can sometimes get confused with a ball in the socket. And as you can see here, but they are different, and the condyloid joints are much shallower. So where is this located? The shallow depression at the distal end of the radius. So we know that this is at the furthest away from the midline. So this is at the opposite end of that radio-ulnar joint, and meet with the carpal bones. So how would we describe it? An oval-shaped bone, okay, or the oval-shaped end of a bone fitting into the oval-shaped hollow of another bone, okay, like you can see on the GIF, we've got the hollow there and the oval-shaped bone fitting in, but it's much shallower than a ball and socket. And this is our biaxial joints. So there's two planes of movement, and we will be doing movement in another video, like I've already mentioned. But we get flexion, extension, abduction, and adduction of the wrist, what we'd be focusing on. Articulating bones, radius, ulnar, and carpals. Okay, so that's our joint type, condyloid joint name, wrist joint. Okay, radiocarpal, but wrist is fine. Now we move on to the ball and socket, the least stable synovial joint because it has the largest range of movement. Okay, so shoulder and the hip, we'll find this. Our example is going to be of the hip, and the hip is more stable than the shoulder because the socket is larger. So if we look at the hip bone there, which is providing the cup-like socket for the head of the femur to fit in, it's much deeper. And while it still has similar movements to the shoulder, they are a little bit more restricted. Okay, so as you can see, very similar there to the condyloid, but what you should be able to see, this sits in a lot deeper, okay, which is why we get more range of motion. Okay, so we get flexion, extension, abduction, adduction, circumduction, rotation. So here, just for the location, it's obviously at the hip. So the head of the femur articulates with the acetabulum of the hip bone. So a simple description, basically from the name, a rounded ball-like end of the bone fits into a cup. So basically a ball fitting into a socket, hence the name. So the description's quite simple for us here. Multiaxial or triaxial. So these allow for all axes and all three planes of movement. Okay, we've got rotation, we've got flexion, extension, abduction, adduction. Okay, so these are our triaxial, our multi-axial joints, and hence why they are the least stable, because there's a lot more happening at the joint. Now, articulating bones there, the femur and pelvis. Okay, and then we move on to the gliding joint, which will also find. Now, This is located very near to our intervertebral discs, the cartilaginous disc, which we talked about in joint classification. So I've tried to highlight it there in blue, and you can actually see the intervertebral disc there in between the vertebrae. But where that blue line is our gliding joint in between the bony processes. Okay, and this is how a gliding joint would move. It's almost like it's gliding, sliding on top of each other because they're quite similar sized, these bony processes. Okay, and what we'll get there is also multi-axial in 3 planes of movement, but please note it is very restricted, not like the ball and the socket. So you'd find this between the superior and inferior processes of vertebrae. Okay, so top and bottom there, and I've highlighted that in blue. And bony processes. The description: the surfaces, they're flat or slightly curved like in the picture, but because they're similar sizes, they do move like you've got 2 coins on top of each other. Okay, and you can also get rotation there, I should say, but we will cover this in a different video. Mobility, like I just said, multi-axial, triaxial, and we'll get all 3 planes of movement, but must be noted they are much heavily restricted in comparison to our other multi-axial joints, which is the ball and socket. Articulating bones of vertebrae, okay, similar to the pivot joint, the atlantoaxial. So what we're going to do now is I'm just going to give you a summary, and you can pause on any point in this video and any slides that you like, but just to start with, we've got condyloid, with our example being the wrist. Its mobility is 2 planes, biaxial, and second greatest range of movement. The hinge joint, the elbow, knee, ankle, 1 plane, uniaxial, quite restricted, but it does allow bending and straightening, flexion and extension. Ball and socket, the shoulder and the hip, 3 planes, multi-axial, the greatest range of movement. Okay, so the synovial joint with the greatest range of movement. Then we have the pivot joint, so that atlantoaxial, okay, being one example, as well as the radial ulnar. Uniaxial, restricted to rotation, and it turns about its axis, which is longitudinal. And then finally, the gliding joint, which is the joint in between them bony processes, with the example being the vertebral column, and it's another multi-axial joint, but severely limited. Okay, and which you'd be able to find out quite simply by doing spinal movements in comparison to movements with your shoulder. And just to finish then, we'll do another summary slide of joints and articulating bones. Okay, so there's the name, there's the type, okay, and then a quick reference of articulating bones. Okay, so that's joint type, and along with the joint classification video, that finishes this little subsection. Okay, so hope that helps. Thank you.